So good morning to all of you, and today we will going to learn about normal sexual behavior. What is there in the lecture you will see. So psychosexuality is the part of psychiatry, and because of some patients come with the complaint of psychosexual issues, and it is the different branch from obs and gynae which deals with the infertility, and the urology department which deals with the uh, other problems of urogenital system, and psychiatry deal with the psychological aspect of sexuality. So why to discuss psychosexuality? The question is what nature wants, why there is sex between uh, animals, birds, human beings, and even uh, plants also. We have two gender, male and female. So what nature wants from both the sexes? Have you do you have any guess or idea why there is two? So the nature only wants the procreation. So that's why there is male plant, female plant, male bird, female bird, and we also the part of kingdom Animalia. We have also female gender and male gender. So the basically nature wants procreation. The species should procreate and move on and make a cycle of their existence. So what is the difference between human versus others? The psychosexual aspect in humans are different from uh, somewhat different from other species. For example, they have a explorative attitude towards the psychosexuality. It is also known as exploration. They are more of experimental. They are satisfaction oriented. So they do not have intercourse because of the uh, only for the procreation, but for the satisfaction also. They seek satisfaction. The patients come with problem of satisfaction in sexual issues. Further, it is recreational. Some people have paraphilic orientation also. You will learn in the different lecture about the paraphilia, and we also have now notified community of LGBTQIA. These people also recognized by the law of many countries and considered normal in terms of their orientations, which is somewhat lacking in the other species. So what is normal other than psychosexual issues? This normal can be applied to any aspect of the human being. It may be considered as a health. If a person is healthy and devoid of any psychopathology and devoid of any physical problems, considered as normal. As utopia means in terms of uh, prevalent of such traits or factors which are more available in the society, we consider it as normal. It is also measured by the statistical means. As an average, if the thing is average, then considered as normal. And some people consider normality as a process, and it cannot be cross sectional. The normality is a process, and in a different situation the functioning behavior and attitude may differ. In some situation it is different, and in any other situation it is different. This means for the context of any particular situation, behavior may be normal, which may be considered abnormal in other situations. So there is a term statistical nicety. If you will see the bell-shaped curve, there is 95% of confidence limit, in which the 2.5% people from ext, uh, extreme deviations are cut out from the normal, while you are considering 95% confidence limit, and considered the people under the bell shape is normal, and the extremes are not fall in the definition of normalcy of that bell shape curve. So here are some statement. You can see that it cannot be and must not be normal to be a cruel just because 95% of your community is cruel. This is one example. If for suppose most of the people have a uh, tendency of cruelty and a few people are not, so this can't be considered as normal by those people who do not fall into that percentage. And similarly, it cannot be and must not be normal to be attracted to someone of the opposite sex just because 90% of general population is heterosexual. And this is in the context of LGBTQIA community. So the person with different orientation may also be considered as normal because they have such a kind of orientation to uh, not for the opposite sex, maybe for the same sex. The third one is it cannot be or must not be normal to own slaves just because all the landowners in your state is in your state own slave. Okay. So majority is not equivalent to normal. If majority of people are doing such a thing, uh, may not be normal, and this is considered in political orientation also. If you have the one ideology, the other ideology may differ from your ideology, and both the ideology are normal for them. Nor can it mean free of discomfort as if normal were the equivalent of oblivious. If you are careless, you are not aware of things, and uh, you are free of discomfort, it also not mean that you are normal. So here is the difference between sex and the psychosexuality. The word psyche has a different meaning when you use the word with the sexuality. So for example, sex may refer to the physiological and psychological process related to procreation and erotic pleasure. This is the sex. And what is psychosexuality? Psychosexuality encompasses all the aspects of sexual behavior, including gender identity, orientation, attitude, and activity. You can see the picture on the right lower corner. The sexuality encompasses the values one have, the communication style one have with the partner, the image of self, the gender, how they socialize. The socialization is also a part of psychosexuality. How they express physically their gender. This is also part of sexuality. Body image and personality. So we can say that psychosexuality is not only inside the bed, it is outside the bed also. The values, the self-image, the socialization, and another aspect of behavior also makes the psychosexuality. This is the definition of normal sexual behavior. Normal sexual behavior brings pleasure to oneself and one's partner, involves stimulation of primary sex organs, including coitus, often leads to climax. And adding to it, it is devoid of inappropriate feeling of guilt or anxiety, and it is not compulsive. So I have highlighted the word pleasure. So this is not uh, uh, equivalent to satisfaction. The word satisfaction can also be used, but it is not about the satisfaction, it is about the pleasure out of it. So this is the definition of normal sexual behavior. Now, can you guess the sex organ, which is the main sex organ, which is present in both male and female? Yes, yes, brain. So sexuality arises from the brain, and the execution of sexuality is by the means of sexual organs, external sexual organs. But whatever the person is uh, gaining from it, fetching from it, is because of the brain. So it is determined by anatomy, physiology, and the culture in which the person lives. Adding to it, relationship with others, their developmental experiences throughout the life cycle. It includes the perception of being male and female, which is a gender identity, and their own private thoughts and fantasies, as well as behavior. And to the average normal person, sexual attraction to the another person and the passion and the love that follow are deeply associated with feeling of intimate happiness. Recreational is also a part of psychosexuality. It is normal in some context, and as opposed to relational sex, to include casual, premarital, or extramarital activity. If it is not in the abundance in one's life, then in some context it is normal. Societal understanding of what defines normal sexual behavior is inconstant and varies from era to era. So social aspect of our like society, what the norm society follows, different culture follows different norms. Some are more liberal, some are more stringent regarding the psychosexual issues. Even in some society, discussing the psychosexual issues is not allowed. While you will find when other societies are more liberal in discussing the issues. Again, nowadays, significant developments in the field of sexuality include study of sexual behavior in older adults that have helped bridge the taboo against the sex in the elderly. So, elderly, the old age life is also considered being considered for good sexual health and the things to be addressed and should be treated or managed because uh, the notion that वो हमारे यहाँ क्या कहते हैं कि पूजा पाठ करने के दिन आ गए ना भजन करने के दिन है तो सिचुएशन इज नॉट लाइक दैट द ओल्डर पीपल कैन ऑल्सो हैव ए गुड सेक्सुअल हेल्थ एंड गुड सेक्सुअल लाइफ सो that age group should also be considered. So sexuality have a biopsychosocial model in which the biological factors like age, gender, genetics, and other aspects of biology and psyche of the patient and the society in which the person lives all together make psychosexual issues. So we can say psychosexuality is a assimilation of anatomy, physiology, the culture, relationships, and the experiences. So, psyche and sexuality is not equivalent to intercourse. Both are the different thing. Intercourse happens only inside the bedroom, and psyche and sexuality, it is always present with the life of the person. So we will discuss anatomical and physiological basis in the brief, and you have gone through these uh, anatomy and physiology of human beings. So I won't dig deeper into this aspect. Okay. So in anatomy, we all know the external genitalia of both male and female uh, have some organs which is primarily known as sex organs. In males like testes, penis, scrotum, and in females like labia majora, minora, clitoris, or other anatomical organs. Yes, this is the G spot, you know, most controversial and most discussed anatomical part. You can see in the picture there is a yellow dot on the anterior wall of vagina which shows the G spot known as Grafenberg's spot. So it is approximately in 1 centimeter in size. Regarding this G spot, what is known is it becomes engorged during the sexual stimulation, and many reports highly pleasurable area, and in some it can induce orgasm. And Grafenberg believed that the tissue here was analogous to the prostate and might account for the spurt of fluid during the orgasm, similar to male ejaculation. Some women state that vaginal orgasm is different experience for them, providing different sensation than a clitoral orgasm. One explanation is that their pleasure is enhanced by the sense of closeness engendered by the coitus. This is regarding the sexual position. Another hypothesis is that these women climax in response to coital stimulation of the G spot. So it's a controversial spot, anatomical spot. Few schools of thought that it exists and some deny it. Here is the physiological response of sexual cycle in females. There is a phase of excitement, and then there is a, you can see in the white line there is plateau, and then orgasm. There is two orgasm and then period of resolution. So females can have different responses during the cycle. Here are the four examples. In the black line, you can see that there are multiple small orgasms, then resolution. In the red line, there is a strong orgasm, then resolution. And in the white line, there is a plateau phase and phase of orgasm and then resolution. In the male, there is a part of excitement, then there is a plateau, the sustainability of that excitement, and then orgasm. And in the dark gray area, you can see the refractory period. And after refractory period, one can achieve the another sexual cycle and can have orgasm. In the refractory period, one cannot have the excitement again. So this refractory period may vary from minutes to days. Some people feel like after 5 minutes doing the another act, and in some people they may take few days, 2 days, 5 days, or 7 days also. So now we start the psychological aspect or psychosexual aspect of learning of sexual behavior. So as I have said that the sexual behavior itself starts in infancy and childhood. The examples are uh, the sexual learning in childhood is adversely affected by uh, sorry. So in infancy and childhood, the one can see that an infant starts exploring his body parts like mouth, eyes, and uh, the infant used to explore his body areas, and sometimes when they grown up and have teeth, they used to bite their finger also, and they started crying after biting. So this is the part of exploration. In a similar manner, infant explore his genitals also and find it pleasurable, and uh, and repeat the activity again and again. They can also learn the behavior by their parents, how they are behaving with each other, uh, their intimate behavior, you know, or maybe in the uh, night time in bed also. So If a sexual learning of childhood is adversely affected by exploitative and abusive adults or incestuous activity with or without penetration or sexual abuse may result into the mm, damaging the child's behavior in psychosexual aspects and other psychiatric aspects also. The person may develop introvert personality or avoidant personality or maybe uh, anxiety disorders also. So it can precipitate sexual dysfunction in adult life as well as promiscuous behavior or problems in intimacy with the partner. And it may produce delinquent activities and behavioral problems in adolescence as well as learning problems in school. So this is also the aspect of psychosexual life that may lead to some other problems in adulthood and adolescence. Some children are inappropriately stimulated short of outright incest or genital fondling, and they are the, you can say they are the objects of extremely seductive parents and termed eroticized children. They frequently become sexually precocious. So how the, you can say the family is also a part of society. So how society is influencing the behavior of a child. Children who view the primal scene, the term Freud used to describe a child seeing sex between their parents, may be traumatized. This is particularly the case if they interpret coital sound and movements as physical aggression between the parents. Now, what happens in adolescence? There is upsurge of sex hormones and the development of secondary sex characteristics. Uh, Masturbation starts at this state, and they also may start caressing and kissing with the partners. Sexual play, other than penetrative sex, sexual play may also be there uh, between the peer group. And once body image becomes more definitive and sense of sexual adequacy and sexual desirability begins to develop at this stage. So they are more definitive in their gender identity, whether they are male or female, or sense of adequacy, sense desirability starts at this age group. What happens in peer group? Peer acceptance by the same sex and by the opposite sex is of paramount importance at this stage. Engaging in sexual talk and jokes, kissing, stimulating genitalia, experimenting with the degrees of nudity, and experimenting with different partner or with one partner are part of process of learning about the sexuality. And more or less, this happens at this stage. Uh, Joking, experimenting the in the adolescence period, when they are not fully known about the sexual process, they may do such a kind of activities. These experiences reinforce the adolescent's sense of being sexual, male or female. Okay, so they got to know whether they are male or female by their identity. First coitus may happen after gaining the puberty, and it is a rite of passage of both sexes. And the young man experiencing intercourse for the first time is vulnerable in his pride and self-esteem. So this is considered as the first coitus is it may be a cause of a disorder known as performance anxiety. If the person is not able to, it is almost happens with the every person who is going to have sex first time. I mean, he will not perform uh, perfectly. So this imperfectness may lead into his mind, and he may discover himself as a having some kind of sexual disorder. This is known as performance anxiety. So any kind of activity which requires experience, it takes time. So young male and uh, the males who are recently married, they may trap into this situation and they may consider themselves as ill. But uh, As this activity requires experience, and other activity which also require experience like swimming, cycling, it requires experience, and you will become perfect uh, by the time and by your practice. So at this stage one can have uh, performance anxiety disorder. So cultural myths still perpetuate the idea that he should be able to have an erection with no or little stimulation. As the information gathered by uh, the colleague who are recently married, a person get to know that the first night should be a perfect night, so this is a myth. The information the person who is getting from other person uh, is maybe his overstatement. Might be that informer is also had the problem of performance. He may project himself as if he is a uh, perfect in sexual activity. So by such a way, in such a way, the myths and misinformation are spread into the society. Similarly, pressure on the woman with her first coitus reflects remaining cultural ambivalence about her loss of virginity despite the current era of sexual liberty. Young women with the history of masturbation are more likely to approach intercourse with positive anticipation and confidence. Studies have shown that young women are more likely to enjoy the first coitus if it occurs in the context of a positive emotional relationship. What happens here is with the females, this is not considered good if they express their psychosexuality. Yeah. They have to remain in the boundary. In our setup, uh, the females are considered to remain in boundary, not to express their psychosexuality. The psychosexuality projected as bad for females. So females are not very open at this juncture. And society, for the year, society made him uh, considered it as a sin. If a female considered it as a sin, that feeling of sin cannot go suddenly on the wedding night. So female may be afraid of or anxious of that activity, and she may not take active part in the activity. So this may lead to discord between the two. In adulthood, by their late 20s, 70% of men and 85% of women have formed a union, either exclusive cohabitation or marriage. The sexual impulse is catalytic in forming and maintaining adult love relationship. Ideally, a mature sexual relationship encompasses the capacity for intimacy and love for one's partner. A sexual excess ceases to be problematic. More attention is focused on activities itself. So they have made a union. The partner is available whenever they have a hormonal upsurge and intense requirement of release of sexual tension. They have available with the partner after marriage. So what happens immediately after it? They are more into the pursuit of career, child rearing, and other family and community obligations. Nonetheless, studies reveal a much higher frequency of sexual interaction among a married person than among single person. The modal frequency of married person is 3 times a month, with many couples relating sexually twice a week. The highest frequency of sexual interaction in studies are 4 or more times a week exist among cohabiting couples. So this, the first one is important uh, because in the initial period of their cohabitation or their unity, they are more focused on sexual activity, and later the uh, things related to career, child rearing, and other family obligations are added into it, and they have divided focus on various aspects of life. So this may also mm, hamper the sexual life. So in general, a graph of sexual practices does not form a bell curve. Most curves of sexual behavior are strongly skewed, with many persons indulging in a particular behavior, conversely, with very people doing so. So you can say that nothing is normal by the rules in psychosexuality. What a couple likes, what a man like, what a woman like, his wishes regarding this activity individually be considered normal. In middle age, frequency of intercourse may decline, may devote much of his energy to the career, de-erotization of women because of her wife-mother role. Now, this is what happens when one live with a partner for a long time. They have developed a relation which is more a wife mother role for a male and father figure role for a female, है ना? They become like जैसे सोसाइटी में कहा जाता है कि 7-8 साल बाद तो भाई बहन जैसे हो जाते हैं, है ना? तो this relationship leads to familiarity. Long relationship leads to familiarity between both, and this may also lead to decline in the frequency of sexual activity. So biologically also, takes longer to reach orgasm. He has a longer refractory period and requires more stimulation to achieve erection. What happens at the middle age? So this is all because of the biological aspect. At this stage, female must adjust to the hormonal fluctuations of her perimenopausal years, and she too requires more stimulation to become aroused. However, middle age is the period of rising extramarital activity. At this stage, somewhat intimacy and love uh, turns into boredom. Okay. So they need extramarital affair for more excitement and more variability in their activity. So this is the period where extramarital activity may be more frequent. But the data shows that 75% of men and 85% of women remains faithful throughout the lifetime of their marriages. So quantity of this affair is very low according to the data. Now comes to the older age. So in the last 2 decades, the coitus has also been a part of sexual repertoire of elderly adults due to the development of drugs like sildenafil, which facilitate the erection in men, and hormonally enhanced cream or pills which counteract vaginal atrophy in the postmenopausal woman. So physical barrier are uh, managed by the medical treatment. Maybe older people are more are in, by the mind they are interested, but physical health is not allowing them. So the treatment like this may help them to lead a healthy sexual life. So this is also a part of assessment also while dealing with the older people. This aspect should also be considered uh, for your assessment. So prior to the development of these drugs, and still today, many elderly adults enjoy gratifying sex play exclusive of coitus, and this is a myth that older people are not sexually active. An aversion to the idea of sex in elderly persists in today's culture. So as I have said before, so 70% of men and 20% of women over age of 60 years are sexually active. And the physiological changes may include a longer time of erection to occur, decreased turgidity, and ejaculatory seepage. Maybe the problem, but still they are active. Active. You know. Similarly, in females, the problems of lubrication and atrophy is associated with lower estrogen levels, and comorbid illnesses, chronic illnesses, almost is the part of this age group. You know. having long-term diabetes, long-term hypertension, and we know that the antihypertensive known to cause decrease in libido, decrease sexual desire. So, physical problem may be the hurdle for this old age group. Yeah. So this was about the what happens during a life cycle of a human being, and we will discuss now the psychosexual factors a person have, okay, on the basis of which uh, we have certain kind of disorders in psychosexual issues. So we have four factors. The first one is sexual identity, then gender identity, then sexual orientation, and the sexual behavior. Okay. So these factors affect the personality, growth, and development and functioning. And again, sexuality is something more than physical sex, coital or non-coital, whether it is coital or non-coital, and something less than the all behavior directed toward attaining a pleasure. So the sexual identity is defined by the genotype. If it is XY, then it is male, and is XX is female. This is biological identity by means of genotype. What is gender identity is uh, in infants with an unambiguous sexual activity, almost everyone has a firm conviction that I am male and I am female. Our environment also let them learn whether you are male or female. When we address to female, so we used to the gender specific words to address her, like तुम कहाँ जा रही हो, ना अगर मेल से बात करेंगे तो तुम कहाँ जा रहा है ना. So this lead to differentiate in their mind that they are male or female. So considering themselves as male or female is gender identity, and this identity may not match with this genotype sometimes. So in this picture you can see a male is seeing himself as female and female is seeing herself as male. So this is gender identity. So if a male consider himself as male, this is also gender identity, and if male is considered himself as female, this is also gender identity. We all have our own gender identity. How we consider ourselves as a male or female. With the gender identity, there is gender role. They consider themselves as male or female. Now, how they uh, express themselves, how they dress, how they talk, what attitude they have. So this also reflects their gender identity, what kind of role they are playing. So if gender identity is not matching, then one will find that the male is somewhat behaving like a female, and female is behaving like by attire and dressing and uh, their style of walking. So they may attain the role of a male. This is gender role. Now is the orientation. Sexual orientation describe the objects of person sexual impulses to whom they are attracted. If they are attracted to opposite sex, it is heterosexual. For same sex, it is homosexual, and for both, it is bisexual. But there are more orientation than these three, and are considered in uh, the umbrella term of LGBTQIA. Okay. We will have the separate lecture for LGBTQIA. We will understand what is the aspects of this. And then the sexual behavior. The behavior includes desire, receptivity, fantasies, pursuit of partners, autoeroticism, and all the activities engaged into express and gratifying the sexual need. Okay, this is sexual behavior. What kind of behavior one person is expressing, and what they are doing to uh, get the gratification from sexual needs. It's an amalgam of psychological and physiological response to internal and external stimuli. One behavior may result from the internal stimuli of just fantasizing about the sexuality, or it may be due to external stimulation, like watching movies or watching a beautiful girl on a street. So, coming to the Freudian viewpoint, this is also important because he gave the theory which is known as libidinal theory, and he related many a uh, disorder and many a behavior with this sexual aspect known as instinct or drive theory. So, one example is uh, when there is increase in sexual tension, this will lead to increase in libido, and that results into the intercourse as a normal outlet. Okay. As per his theory, this happens in a sequential manner. So, according to Sigmund Freud, libido is that force by which the sexual instinct is represented in the mind. Na? But this is misinterpreted by some people that it is related to sex, but his concept was not related to sexuality only. Libido, his libido was not equal to sexuality. Okay. What was that? The general notion of pleasure and sexuality, and when it is combined with physiological underpinnings, and it results into the mental representations. Okay. We will understand by this example. So again, there is increase in the sexual tension, and he remain abstinent from the sexual activity or may practice coitus interruptus. What is coitus interruptus is while doing the sexual activity, ejaculating outside the female sexual part. Okay. This coitus interruptus. This is leads to libidinal blockage, and this blockage leads to anxiety, neurosis, neurasthenia, hypochondriasis, and other disorders. So I can remember that when I didn't know the Freudian viewpoint, and in emergency posting, the patient of hysteria, known as conversion disorder or uh, dissociative disorder, presented in the emergency, and the notion was that this is because of the sexual deprivation. In the mind of seniors, it was they were belong to emergency medicine, internal medicine, and this is the libidinal theory is misinterpreted as it is because of the actually because of the sexual part, but it is not. Okay. So stages of psychosexual development he gave. Okay, here are the few points of Freud. So based on his theory of childhood development on the belief of sexual energy termed libido was the driving force of human behavior. So this libidinal force is the driving force of human behavior, and this behavior may be different kind of behavior. He proposed that children progress through these 5 stages of psychosexual development. He gave the 5 stages of psychosexual development, and psychopathology results when a person has difficulty making the transition from one stage to next stage, when a person remains stalled at a particular stage or regress to the earlier stage. He gave the 5 stages, and according to his theory, he believed that this libidinal thing, when the person is fixated at the particular stage, may lead to some kind of behavior or disorders. So this is the these are the stages. The first one is oral phase, which is from birth to first year, and the erogenous zone is mouth. So at this stage, usually a infant plays with his mouth, plays with mouth, try to grab things from the mouth, try to experience the thing with the taste. whatever it is. He tried to put anything into the mouth. So he defined this as a oral stage. Okay. So consequence of physiological, psychological fixation at this oral stage may lead to orally aggressive person, which may be shown in the behavior of prolonged chewing the gum and nibbling the end of the pencils, etc. And orally passive behavior like smoking, eating, kissing, oral sexual practices may lead because of this oral fixation. And it may also result in passive, gullible, immature, manipulative personality. Then he defined the anal stage, anal stage from 1 to 3, the bowel and bladder elimination. When the person started, the child started have some kind of control on it, and there is two type of fixation. One is anal retentive and anal expulsive. When the person is fixated in retentive type, he may it may lead to obsessively organized or excessively neat kind of behavior in the person. And when it is expulsive, he may become reckless, careless, defined, disorganized, or coprophiliac also. The phallic stage is from 3 to 6 years. This is genitalia stage. And in this stage, he explained a Oedipus complex in the boys, and counteracting this Oedipus complex or equivalent to this Oedipus complex, Carl Jung has given the idea of Electra complex. We will learn in the next slides regarding these complexes. Then there is a latency period, which is from 6 to puberty, when the person gains the puberty. This is dormant, erogenous zone is dormant sexual feeling. Sexual feelings are started developing at this stage for another person. And fixation may lead to immaturity and inability to form fulfilling non-sexual relationship as an adult if fixation occurs at this stage. So non-sexual relationship means the relationship out of the sexual activity, the person may not able to form this. And then this is the genital phase, which is puberty to death. The sexual interest matures. This may lead to, the fixation may lead to frigidity, impotence, perversions, great difficulty in forming a healthy sexual relationship with another person. So these are the 5 stages he defined according to his mind, and which is rejected by the other schools of thought that this is not the true. So coming to the Oedipus complex, what is Oedipus complex is, uh, the Oedipus complex refers to a son's sexual attitude towards his mother and concomitant hostility towards his father, first formed during the phallic stage of development. And the complex thought to persist into adulthood as an unconscious psychic structure, which can assist in social adaptation but also be the cause of neurosis. So Freud considered that the child identification with same-sex parent is socially acceptable outcome of the complex, uh, while for the opposite sex it is not acceptable. The theory is named for a mythological figure, Oedipus, from where the theory has came. A mythological figure, Oedipus, an ancient Theban king who discovered he has unknowingly murdered his father and married his mother, whose depiction in Shopkill's Oedipus Rex had a profound influence on Freud. है ना? This depiction has an influence on the Freud's mind, and it came from a mythological figure. It is not true. This is a mythological story from where he was impressed. In contrary to it, Carl Jung gave the concept of Electra in 1913, and is proposed as equivalent complex among the girls as for the Oedipus complex. It is a girl's psychosexual competition with her mother for possession of her father. It is also came from a Greek mythological character Electra, who plotted matricidal revenge with Orestes, who was her brother, against Clytemnestra, their mother, and Aegisthus, their stepfather, for their murder of Agamemnon, the, her father. है ना? So Freud rejected his Electra complex, and these were the developments at the time when uh, we can say the era of uh, when we started looking the things scientifically. All the science were developing along with each other. Like uh, someone has discovered that sun is not revolving around the earth, and earth is actually revolving around, and other theories are developing, like Newton uh, and other scientists. So psychology was also developing their ideas and generating their theories, though this is out of that era. So without this understanding this uh, concept, one cannot move further into the psychology. And although these are the rejected theories, and nothing has been found in the structured um, clinical trials that this is this is the situation. Other than these uh, theory of Freud, the other main developmental theories are Erickson's model, behavioral child development theory, Piaget cognitive developmental theory, Bolway attachment, Bandura social learning. So these are the developmental theories, uh, maybe revolving around other aspects of human life, but psychosexuality is a definite part of human life. So these theories also discuss the psychosexual aspects, but not as the libidinal theory of Freud. So in the end, what is normal? So normal sexuality is a complex and subjective concept that depends on various factors such as biological, psychological, social, and cultural aspects. So when we look for a normality of an individual, we should consider all the aspects: his or her biological aspect, their psychological aspect, what they think, what the society of his or her thinks, and the cultural values in their society they have. So we look upon into it also while assessing a patient with a psychosexual issues. So thanks.